Pregnancy symptoms. While pregnancy tests and ultrasounds are the only ways to determine if you're pregnant, there are other signs and symptoms you can look out for. The earliest signs of pregnancy are more than a missed period. They may also include morning sickness, smell sensitivity, and fatigue. When do the symptoms start? Though it may sound odd, your first week of pregnancy is based on the date of your last menstrual period. Your last menstrual period is considered the first week of pregnancy, even if you weren't actually pregnant yet. The expected delivery date is calculated using the first day of your last period. For that reason, the first few weeks where you may not have symptoms also count towards your 40-week pregnancy. What happens in the first month of pregnancy? Pregnancy is divided into 3 trimesters. Each trimester is a little longer than 13 weeks. The first month marks the beginning of the first trimester. What's gestational age? Pregnancy timing is measured using gestational age. Gestational age starts on the first day of your last menstrual period, LMP. Gestational age can be confusing. Most people think of pregnancy as lasting 9 months. And it's true that you're pregnant for about 9 months. But because pregnancy is measured from the first day of your last menstrual period, about 3 to 4 weeks before you're actually pregnant, a full-term pregnancy usually totals about 40 weeks from LMP, roughly 10 months. What happens during week 1 to 2? These are the first 2 weeks of your menstrual cycle. You have your period. About 2 weeks later, the egg that's most mature is released from your ovary. This is called ovulation. Ovulation may happen earlier or later, depending on the length of your menstrual cycle. The average menstrual cycle is 28 days. After it's released, your egg travels down your fallopian tube toward your uterus. If the egg meets up with the sperm, they combine. This is called fertilization. Fertilization is most likely to occur when you have unprotected vaginal sex during the 6 days leading up to, and including the day of, ovulation. What happens during week 3 to 4? The fertilized egg moves down your fallopian tube and divides into more and more cells. It reaches your uterus about 3 to 4 days after fertilization. The dividing cells then form a ball that floats around in the uterus for about 2 to 3 days. Pregnancy begins when the ball of cells attaches to the lining of your uterus. This is called implantation. It usually starts about 6 days after fertilization and takes about 3 to 4 days to be complete. Pregnancy doesn't always happen, even if an egg is fertilized by a sperm. Up to half of all fertilized eggs pass out of your body when you get your period, before implantation is complete. What are the signs of pregnancy? For a lot of people, the first sign of pregnancy is a missed period. Most pregnancy tests will be positive by the time you've missed your period. Other early pregnancy symptoms include feeling tired, feeling bloated, peeing more than usual, mood swings, nausea, and tender or swollen breasts. Not everyone has all of these symptoms, but it's common to have at least one of them. What happens in the second month of pregnancy? The ball of cells turns into an embryo at the start of the 6th week. The embryonic stage of pregnancy lasts about 5 weeks. This is when all the major internal organs start developing. What happens during week 5 to 6? The embryo is less than 1/5 inch, 4 to 5 millimeters, long. A very basic beating heart and circulatory system develop. That's for arms and legs develop. The neural tube begins forming. The neural tube will later form the brain, spinal cord, and major nerves. The butt of a tail develops. The umbilical cord begins developing. What happens during week 7 to 8? The embryo is 1 by 4 to 1 by 2 inch, 7 to 14 millimeters, long. The heart has formed. Webbed fingers and toes develop. The arms bend at the elbows. External ears, eyes, eyelids, liver, and upper lip begin forming. The sex organs are the same, neither female nor male, in all embryos until the 7th or 8th week. If a gene triggers the development of testes, the embryo develops as a biological male. If there isn't a trigger, the embryo develops ovaries and becomes biologically female. What happens in the 3rd month of pregnancy? The embryo becomes a fetus when you're 3 months pregnant. The umbilical cord connects the fetus to your placenta and uterine wall. External sex organs also start to develop. What happens during week 9 to 10? The embryo develops into a fetus after 10 weeks. It's 1 to 1.5 inches, 21 to 40 millimeters, long. The tail disappears. Fingers and toes grow longer. The umbilical cord connects the abdomen of the fetus to the placenta. The placenta is attached to the wall of the uterus and it absorbs nutrients from the bloodstream. The cord carries nutrients and oxygen to the fetus and takes waste away from the fetus. What happens during week 11 to 12? The fetus is now measured from the top of its head to its buttocks. This is called crown rump length, CRL. The fetus has a CRL of 2 to 3 inches, 6 to 7.5 centimeters. Fingers and toes are no longer webbed. Bones begin hardening. Skin and fingernails begin to grow. Changes triggered by hormones begin to make external sex organs appear, female or male. The fetus begins making spontaneous movements. Kidneys start making urine. Early sweat glands appear. Eyelids are fused together. What are the symptoms of pregnancy in the 3rd month? Many of the pregnancy symptoms from the first 2 months continue, and sometimes worsen, during the 3rd month. This is especially true of nausea. Your breasts continue growing and changing. The area around your nipple, the areola, may grow larger and darker. If you're prone to acne, you may have outbreaks. You probably won't gain much weight during the first 3 months of pregnancy, usually about 2 pounds. If you're overweight or underweight, you may experience a different rate of weight gain. Talk with your nurse or doctor about maintaining a healthy weight throughout your pregnancy. What happens in the 4th month of pregnancy? Your 2nd trimester begins during your 4th month of pregnancy, starting on week 14. Click to watch next part of this video and get more information. Click to subscribe for more videos. Thanks for watching.